name's Katie. I'm going to be your nurse today. Today we have a cranial nerve assessment. How does that sound?
Sounds goody.
Okay, so for the purpose of this presentation, I won't be testing cranial nerve 1, but that's the olfactory nerve. So I'll skip to cranial nerve 2, which is the optic nerve. And for the purpose of this presentation, I'll be describing the Snellen chart. So that's a chart of letters and numbers that's 20 feet away from the patient. And I would ask them, do you wear glasses or contacts?
Yes, sir.
She does, so I would have her wear those during the exam. And standing 20 feet away from the chart, I would have her cover her right eye and read the lowest line that she's able to. And if she's unable to read the whole line, missing 3 or more marks, I'd have her read the line above that. And if the first line was 20/20 vision, but she successfully read the line above that, she would have 20/25 vision. And then I'd have her uncover that eye and cover her left eye. And do the same thing, try and read the lowest line possible. After that, I'd have her uncover both eyes and use them together to try and read the lowest line. The next nerve is cranial nerve 3, which is the ocular motor nerve. So I'm gonna have my finger 8 centimeters away from her and have her follow my finger with her eyes. And I'm testing for the direct pupillary response, watching the pupils, looking for any extraocular movements, which there were none present. And then I'd have my pen light and look straight ahead. And I'm looking for constriction of the pupils in both pupils, which there was, and they were 3 centimeters in diameter. And then I'm going to put my hand on her nose and watch for the indirect pupillary response. So both pupils were the same size and shape, and they constricted with light. So that was intact, and then I'm going to test for perla. So stay looking straight ahead. And pupils were round, equal, and reactive to light, and to test for cranial nerve 4, which is the trochlear nerve. I'm going to test for accommodation and have her follow my pen light with her eyes. And that nerve is intact, as well as cranial nerve 3. Cranial nerve 5 is the trigeminal nerve. So I'm going to have her open her mouth with resistance and try and turn with resistance. This is also a sensory nerve, so to do that I would have like a cotton ball and touch it to her face, scalp, and cornea. Moving on to cranial nerve 6, which is the abductens. We completed that when we did the cranial nerve 3 assessment with the lateral eye movement. So that cranial nerve is intact. Cranial nerve 7 is the facial nerve. So I'm going to have her open and close her mouth as if she was chewing. And then say her full name.
Brianna Moody.
Looking for the labial response. And then moving on to cranial nerve 8, which is the vestibular ocular. I'm going to do the whisper test by plugging one of her ears and whispering a 2-syllable word to her being 2 feet away, and she's going to repeat it. Baseball. And do the same thing on the other side, plugging the other ear.
Basketball.
So that cranial nerve is intact. And moving on to cranial nerve 9 is the glossal pharyngeal nerve. So she's going to open and say ah, ah. And the uvula has rise and fall with phonation. And during this time I could test for the gag reflex, but I don't have a tongue blade or glove. So for the purpose of this presentation, we'll skip over that one and move to cranial nerve 10, which is the vagus nerve. I'm going to have her say her full name and date of birth.
Brianna Moody, July 24th, 2000.
And there was clear, no hoarseness, and then I'm going to palpate as she swallows. Okay, and so that was intact, and then cranial nerve 11 is the accessory nerve, so I'm going to have her resist my hand. And then resist my hands with her shoulders. So cranial nerve 11 is intact, and then cranial nerve 12, which is the last one, is the hypoglossal nerve. And to do that one, I'm going to have her stick her tongue out, and it's midline, and move it side to side. And I'm looking for any deviations, which there weren't any, so that nerve was intact. And that concludes my assessment on cranial nerves.